This bill, again, accomplishes two harmful, damaging impacts to America, which is number one, people are going to lose their health insurance, 15 million. We're also going to see the deficit grow by anywhere between 3 and 5 trillion. And for what? To reward the top 1% whose tax cuts are going to be extended and enlarged for many over the coming years, leaving working families and the poor in the dust. We can do better. Thank you, Mr. Speaker. Today, June 3rd, Congress reconvenes after a 12-day break. Last time we were here on May 22nd, this chamber was involved in a 2-day marathon where H.R. 1, the misnamed One Big Beautiful Bill, was jammed through in the dead of the night as it was being written in real time by a vote of 215 to 214. During my time home, I held 2 town halls, one up in Towin, Connecticut, near the border of Massachusetts, and down along the shoreline in Madison, Connecticut, both well-attended. Last night in Madison, it was standing room only. People were bursting with questions about how a bill that can change the tax code for the next 10 years, that can intervene in terms of our healthcare system, in terms of taking away people's health coverage, could happen with no transparency, no public input, as I said, as it was being written in the dead of the night prior to the vote on May 22nd. So this is what we know now as the dust has settled in terms of what the impact of this bill is. In terms of health care, the bill is going to cut our Medicaid program, America's largest health care program, and extract roughly $700 billion from the system over the next 10 years. The Affordable Care Act, subsidized premiums, which provides health insurance for millions of Americans. Again, those premiums are going to be cut. And as a result, people are going to lose their health insurance. That's not me saying that. That's the Congressional Budget Office, the neutral umpire that calls balls and strikes around this Congress. And again, they have calculated that 15 million Americans will lose their health insurance as a result of this measure, which was passed, again, by the majority, jammed through in the dead of the night. In Connecticut, we've already seen what the numbers mean in terms of this bill. The Kaiser Family Foundation, again, not a partisan group. They have been studying healthcare trends in finance for decades, and they determined that 140,000 citizens in the state of Connecticut will lose their health coverage as a result of this bill. Now, one thing that didn't get a lot of attention, but again, as the dust has settled, we now know, is because of the deficit impact of this bill, which is going to add trillions of dollars to the national debt. It's going to trigger a sequestration automatic cut to the Medicare system, the system that provides health insurance for people over 65 and people on disability, $500 billion over the next 10 years. And again, it's going to be a cut across the board to hospitals, to physicians, to a whole series of medical devices and products, pharmacy products that are covered by Medicare, again, because of the reckless deficit spending that this bill created. And again, that's not me saying that. The Joint Committee on Taxation, their calculation is $3.7 trillion of new debt on top of the $36 trillion of debt that we have today. Wharton School of Finance, where President Trump he attended school, they calculated $3 trillion as well. And when they added the interest costs that are going to be paid on that additional deficit, that spending, that's going to push the number closer to $5 trillion. Again, today it's $36 trillion is the deficit. We're spending $89 billion a month in terms of interest costs on the existing debt. That's larger than what we spend in the Department of Defense on a monthly basis. It's bigger than any other account in the discretionary budget of this government. This bill, again, accomplishes two harmful, damaging impacts to America, which is number one, people are going to lose their health insurance, 15 million. We're also going to see the deficit grow by anywhere between 3 and 5 trillion. And for what? To reward the top 1% whose tax cuts are going to be extended and enlarged for many over the coming years, leaving working families and the poor in the dust. We can do better than this as a nation. And again, it is not too late to stop this. The Senate is now going to be taking this bill up, and the external pressure that is going to rise up with the American Hospital Association, patient groups like the American Cancer Society, the American Lung Association, Autism Speaks, people who represent disability groups, they are rising up now to stop this bill because of the harm it's going to cause on individuals and families all across this country. It is time to stop this one big ugly bill that is going to do so much damage to the American people. I yield back.